That's a tricky question. There's so much incredible work here. I think when we see some of the clinical outcomes, so for me, I work in public health and we see public health policy change, and it takes a long time to see the difference in terms of, obesity rates in countries. But when I see what colleagues do working individually with patients and with families, and you can really transform people's lives. So you could go from, very poor mobility, very poor, health outcomes, and, within several months of all of the hard work of these multidisciplinary teams, they've got they're doing more physical activity, they've changed their body weight, they've changed their depressive symptoms, and they're happier, and they're enjoying life a lot more. And I think that's incredible. So it's a real mix of stuff, isn't it? And that shows with obesity, there's no one solution and there's no one way of dealing with this. There are multiple different efforts, and we all need to make that effort from all our different countries and different programs. And that's the only way that we really need to deal with this. So I think the main conclusion is that digital addiction is unclear at this moment, but certainly young people are using screens a lot, and the evidence to show that that's associated with overweight and obesity is very, very clear. And I set out in my talk a number of reasons for that. So often it's sedentary, often it's full of food marketing, it's influencing food purchasing decisions, intake, and often there may be issues around, depressive symptoms that people are experiencing, and that's why they're seeking time online rather than, with friends in real life. But thankfully, there are interventions that work, and we're learning all the time better ways to support people to make that change. Australia are the first to go as far as a social media ban, but I know a lot of other countries are looking at that to see how well it works and to think whether something similar, or maybe, a diluted level of restriction or a higher age range or something might be appropriate for them. So it'll be interesting to see what the evidence shows in the next couple of years. It's a great question. Yeah, I think it should all be combined. So we've heard already about the different approaches that different clinical groups take, multidisciplinary teams take, and then looking at, the lifestyle factors of individuals and their preferences, their environment, and so on. And I think as part of that, and those conversations and that treatment, the use of digital media and their management and time management strategies should absolutely be part of this. Because you can't treat a problem and then send somebody back into that same environment where that problem is going to, be triggered again and re-emerge. So I think that the more things we can equip people with, the more tools to help them navigate the real world and the virtual world in a healthy way, then that's only going to lead to better outcomes.